Wow, well, thank you so much for your patience whilst my colleague was disposed in the toilet. We are absolutely in shock at being selected as the winner for this category when the competition is so stiff. So we're really honoured to be here, and I'm sharing the stage. So I'm Joseph Manning, and I currently work as a clinical associate professor and a charge nurse in the Children's Hospital at Nottingham. And I'm joined by my colleagues, Louise Bramley and Joanne Cooper, who are the Assistant Directors of Nursing at Nottingham University Hospital's NHS Trust. Unfortunately, on the slide here we have one of our Chief Nurse Fellows who unfortunately couldn't make it today, but we're representing all of our Chief Nurse Fellows during this presentation, so hopefully we'll do them proud. So what we want to do over the next 9 minutes is give you a bit of an overview of the background and the context as to this initiative, give you some examples of what our Chief Nurse Fellows were doing to improve the experience outcomes and quality of care for our patients and families, and also talk about some of the wider impact that we've been having. So without further ado, I will continue. So as many of you will be aware, if you've engaged with the media, we have a global crisis in relation to our healthcare workforce, and predominantly we've been focusing on nurses because we have a national deficit in our nursing numbers. There's around 1 in 8 nursing posts that are vacant nationally, and what we know from the evidence is that deficits in staffing numbers lead to poorer patient outcomes and experience, and also decreased staff satisfaction. And so there is a real pertinent drive to think of sustainable and flexible and innovative solutions to try and address some of this recruitment and retention crisis that we've got within our wider healthcare workforce, but particularly our nursing workforce. And so back in 2015, Jo Cooper did some extensive stakeholder work with a lot of our nurses, and in an organisation that employs around 17,000 staff, about 5,000 of them, or a third of them, are registered nurses, and half of those are frontline nurses, band 5 nurses, to understand what their needs are, what are their desires, and that resulted in it being identified that there's a desire for a lot of these registered nurses to stay at the front line, to be delivering direct patient care, but they also want opportunity to develop themselves as a leader, and also lead developments within their clinical care to improve the experience outcomes and safety of care for their patients and families. It was identified that they wanted earlier career opportunities and opportunities to experience the challenges and opportunities of conducting and leading innovation within an NHS organisation. And so back in 2016, myself and Jo had a conversation with our chief nurse at the time, who is our chief nurse now, and we talked about a fellowship programme, an opportunity to empower frontline nurses, ODPs and midwives to develop and to undertake a quality improvement initiative. And we had board level support to drive forward this initiative. And as you can see, there's 2 components of this initiative. The first component to us was the most important, because this is about developing that individual to be that future leader, equipping them with the skills and knowledge in clinical as well as academic and leadership skills to embed and lead change. And then the second component was a quality improvement initiative. Certainly for the fellowship initiative, it was about working in partnerships. So certainly working in partnerships between different levels of our organisation. So we have divisions and we have a corporate team. So it's working across sort of conventional sort of barriers, and for those nurses and ODPs and midwives that were recruited into the initiative, it was through a competitive process. They had 1 day a week to work on their initiative, whether that's developing themselves or developing their quality improvement initiative from the front line, and that was to give them the headspace and to give them the time to develop themselves and their project. They also had a robust sort of programme of academic and clinical mentorship to enable them to develop the skills and the knowledge and to support them through their journey in developing as a Chief Nurse Fellow. So that's a whistle-stop tour through the context and background, and I'm going to hand over to my colleague Louise, who's going to talk to you about the interesting stuff.
Thank you. Not from the toilet, thankfully, on this occasion. So thank you for your patience. So we had hoped that Jodie would be here with us today to talk about her project. She isn't, unfortunately, so I'm going to tell you a little bit about it. And as Joseph said, we deliberately took the pressure off by telling these very junior nurses that it wasn't about the project, it was about developing them. Fortunately for us, their projects completely smash it out of the park, and some of the things that they have engaged in have been absolutely phenomenal, and interestingly have led to some of the major change programmes that happen at our hospital, which is really exciting for us and extremely exciting for them and their careers. So Jodie is a staff nurse in our emergency department. She's a band 5 nurse. We have over 700 people coming through our front doors every day, a large percentage of whom do suffer from mental health problems. She was newly registered band 5 nurse, and she recognised from the off that she didn't feel that mental health patients got the same assessment and treatment that our patients who came in with much more conventional long-term conditions or emergency illnesses that were much more physically derived. What this led to was longer length of stays for some of our mental health patients, extremely difficult and distressing situations for them where they were not being cared for in a way that perhaps we would have liked that to happen. So she developed an assessment tool. The assessment tool was based around some of the tools that we already had, but she worked in partnership with a number of different stakeholders throughout the emergency department. That was implemented, and that's led to reduced length of stay within the emergency department for our mental health patients. That's also leading on now to an area within the department that's much more kind of physically comfortable for this group of patients, which is fantastic. We had another Chief Nurse Fellow, Sharon, who actually came into nursing slightly later, having fulfilled a career in a completely different thing. And what she noted was that patients with neutropenic septicemia were with us way longer than she felt necessary. They were having over and above the amount of antibiotics that they should have been, that they needed, and that their length of stay was longer than necessary because we couldn't process the blood tests as quick as we needed to. So one of the things that she did do was spoke to her friend, interestingly enough, in another department, and talked them into allowing her to use the blood analyzer in order to find out whether patients were neutropenic quicker. That led to a huge saving for the Trust, financial saving, and it's been a really successful project. We've also had the projects that I talked about, which are much more about kind of setting up for larger projects. And one of those was a project that we had done by one of our colleagues, Frankie, who's a paediatric nurse who actually worked alongside Joseph. And she was looking much more closely at transition. And it was the literature searching that she did with the evidence that was already out there that enabled some real conversations to start happening about how we were going to improve that transition. I'm just going to hand over to Jo, and she'll be able to tell you a little bit more about the results and impact.
Thank you, Louise. Thank you, everybody. So we do have some examples of where you might want to find out more about this, and one of those is in a publication here that you will have the link to. We've summarised the project with some more details about that, but clearly impact isn't just about publishing, but it's really important to get that information out there. So we'd encourage you, if you'd like to know more, speak to us and also have a look at one of the papers that we have. So this started with a pilot cohort of 6 in 2016, and we now have a further 22 to date. The entire cohort, importantly, has been retained in our organisation, some of them moving on to more junior leadership programmes and positions, but all remaining very clinically focused, which is really important, both for those aspiring to these kind of roles, but important to the best for patient care. So these are some of the comments. It's about being able to work broader, understanding some of the more political issues, and then having opportunities to meet people that traditionally you or I may never have been able to do so. To understand why things don't happen as quickly as we might want them to, but that was really important for them as well. So in themes, I suppose it's about individual exposure, insight and growth, understanding the context, getting that support, people knowing who you are, but you knowing who they are as well. It's about having the ability to work on an initiative and project that really fires you up in your belly, and that you have the expertise because you're with a patient mostly 24/7. That's who the nurses, midwives, and the ODPs are there with the patients more often. So they're published, and they've published more broadly, academy, NHS Fab stuff, for example, that you might want to look at. And then it's about developing the talent at the front line. So this is just a picture, and I suppose this sums it up. It's about nurse leaders of the future learning skills at the bedside. Thank you.
Oh,